I'm Dr. Tony Hong. Oh. I'm Dr. Tony Hong, and on behalf of myself and Dr. Archipoli, we appreciate your time today for our Women's Health Lecture. We especially want to thank our community partner, the Women's Fund for Health Education and Resiliency, for their many years of collaboration and support. They are an award-winning local nonprofit, and they are also the recipient of the prestigious 2020 Partners in Education Award. So we're really proud to continue our relationship with them. And we also want to express our gratitude for Dr. Segal from Kelsey Siebel, who's joining us today as our speaker. And I don't know about you, but I know I'm constantly bombarded with health news and information by mass and social media. It's really impossible to process everything. So I really enjoy these intimate talks where we get to hear and talk one-on-one with a health professional. It provides a space for listening and engagement on several important health topics. So I'm really looking forward to today's presentation. So now I want to turn it over to Kayla Rogers from the Women's Fund, who's going to make the official introduction with Dr. Segal.
Awesome. Thank you so much, Tony. Again, thank you for being here today. We have loved working with UHD over the last few years. I know personally, it's one of my favorite things that we do because like Tony said, the group is intimate and we get to have really wonderful conversations. My name is Kayla Rogers and I work as an education and outreach specialist or coordinator for the Women's Fund. And we are a not-for-profit organization located in Houston. Our mission is to provide women and girls with the tools that they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. All of our programs and publications are free. I highly encourage that you visit our website to see what events we have coming up. Check out our publications. You can download PDF versions or request physical copies. And if you're ever interested in finding volunteer opportunities, we do have plenty right now as we have started back up with some of our curriculum classes for girls. So I highly encourage you visit the website or reach out to any of us here at the Women's Fund if you're interested in learning more or becoming involved. So today's presentation is the first of the semester, and it is over preventative healthcare, things you can do to add years to your life. And we are very fortunate to have Dr. Pooja Segal here. We've worked with her a few times before, and she is absolutely wonderful. So I'm going to go ahead and do a brief introduction before I turn the floor over to her. So after graduating from medical school at Government Medical College in India in 1997, Dr. Segal went to the Wichita Falls Family Medicine program for her internship in family medicine, which she completed in 2005. She completed her family medicine residency at Baylor College of Medicine in 2007. Dr. Segal is a member of the American Academy of Family Physicians, the Texas Academy of Family Physicians, and the Harris County Medical Society. She is currently serving as president of Harris County Academy of Family Physicians. When she's not caring for patients, she enjoys spending time with her children and traveling. So Dr. Segal, we're so grateful to have you here today, and I'm going to go ahead and turn the floor over to you.
Thank you, Kayla, for the introduction. Just a little direction there. I am not currently the president of Harris County. I was the past president. But anyways, I like this opportunity to be able to talk to you guys. I wish we could meet in person like we have done in the past, but for now, I think due to the pandemic, this is our way of communicating and reaching out to our audience. And I'm going to keep this very, very simple. We are going to talk more about prevention, but I am open to any questions that you have regarding other topics also at the end of this presentation. I hope all of you can hear me okay. If not, feel free to put something in the chat if you can't hear me well. So to start off, we are going to talk about why do we put so much emphasis on prevention or preventative medicine? Because once we start doing prevention, we are more likely to identify chronic diseases early and at a more manageable state. Sorry. If we look in this country, when it comes to looking at disease and all kinds of different diseases, chronic diseases, one thing you will understand that a lot of this disease can be corrected by doing more prevention, doing more lifestyle changes, and you end up not getting sicker. So examples would be heart disease. Examples would be certain cancers. So all of these are in some ways related to your lifestyle. Some of these are genetic, and yes, there are so many other factors, but we at least need to do our part in trying to do things right today so that you don't end up in the trouble tomorrow. So doctor is able to benchmark and track changes in your overall health if you're doing more preventative visits or more like, I'll say, general physicals. And then, of course, if you track over a period of time, people who are more vested in their health and do more preventative visits, they end up with lesser ER visits and hospital stays. Next slide, please. So what can you do yourself? Hold on, let me just make the screen bigger. So it's important for you to know your numbers. When it comes to knowing your numbers, the usual things that we should know about is what is your blood pressure, your cholesterol numbers, your sugar numbers, and then your height, your weight, and your waist size. So these are the things I'm going to talk about in more detail later. But this is something that when you see your doctor for more like a wellness check or your physical or your preventative annual visits, this is everything that the doctors check and plus more stuff. It's very important to have a primary care physician where you can get your annual physical, you can get your age and gender appropriate screenings for heart disease, screening for cancer, and of course, communicate freely with your doctor regarding any problems or any concerns that you have about health in general. And you have to do your part. You have to make healthier and better lifestyle choices. So if you're a smoker, you have to stop smoking. You have to eat healthy diet. Mediterranean diet I just put in here because it's considered one of the healthiest diets. And of course, you have to exercise. So if you take nothing from this talk today, the only thing at least you have to remember is eating healthy and exercising will actually help you stay healthy for a longer period of time, avoid a lot of hospital stays because you're not going to end up with a lot of diseases. Next slide, please. So when you know your numbers today, you have the power to achieve a healthier tomorrow. Preventative screenings in partnership with your physician create an early warning system. They also provide a tool for evaluating your risk of developing chronic illnesses. Also, they help you monitor the progress of a disease. This is actually your opportunity to talk to your doctor regarding improving your overall health. And as we all know, that ounce of prevention is worth a pound of cure. Next slide, please. So we are going to start off with your body mass index. You may have heard about body mass index. This is used in a lot of discussions, a lot of talks. It's very easy to calculate it yourself. And body mass index is a very simple measurement. It is a number that is calculated from your height in inches and your weight in kilos. And of course, I have thrown in waist circumference, but waist circumference calculation is not a part of your body mass index. So body mass index is reported as kilos divided by your weight in kilos divided by height in meters square. And it is a reliable indicator of body fitness for most sedentary people. And it is used to screen for weight categories that may later on lead to health problems. When I talk to patients, I always tell them, remember, this is just one indicator. This is our starting point. This is not a perfect indicator though, right? But this is a very reliable because a lot of studies have been done. And at least for sedentary people, this is a good one. Now, if you are athletic and you are really a marathon runner or you are in competitive sports, then this is not a very reliable indicator in those people because their bone mass and muscle mass is very high and that can put them in overweight category even though they are healthier. But for most other people, I think this is a very good indicator. Next slide, please. So this is, just showing you in a regular 5'9" person. I mean, it could be a man or a woman. This really is not gender specific. But overweight and obese are the labels for the ranges of weight that is greater than what is considered healthy for a given height. So your height remains static in adulthood, but it's your weight that fluctuates. So anybody who has BMI less than 18.5 is considered underweight. I mean, sometimes you see these young girls who are really very active and, they are put in underweight category. Underweight does not necessarily mean a disease. Some people just are leaner and by structure, they are in this category. So we do not start, a discussion if they are otherwise healthy. However, if there's a girl who starts having other symptoms, like changes in menstruation and is a very avid runner, then it could be a problem. Those are the women we need to talk more about. Most of times men, you don't have, very many men with very low body mass index or underweight, but, there could be few. As I said, that it doesn't take into consideration your gender. And of course, male and female bodies are slightly different. Females do have more fat in the body compared to men. But anyways, the healthy weight is keeping your body mass index between 18.5 to 24.9. This will be where you would want to be when it comes to body mass index. There are, of course, many factors that affect your body mass index. If your body mass index goes beyond 25, but up to 29.9, you are considered overweight for your height. And if your body mass index is more than 30, then it becomes obese. And then if your body mass index is more than 40, you are considered morbidly obese. The morbid obesity is basically a kind of, I look at it like a disease in itself, because if you are that much heavier for your height, that your body mass index is more than 40, it does lead to a lot of other problems. It does increase your risk of heart disease in future, your diabetes, your high blood pressure, cholesterol, so all kind of things. So at that point, your weight by itself becomes an independent risk factor for heart disease. It's good to maintain healthy weight as much as humanly possible. But once you're going beyond a certain weight, then as I said, it becomes a problem or a disease in itself. Next slide, please. So then this is another indicator, body composition. As I said, body composition or body fat percentage is different in men and in women. I do not pay a lot of attention to this, but you have to still know that women tend to have more fat because we have curvy bodies compared to men who have more like straight bodies, and they do have less body fat percentage. So, fat calculation or body fat percentage calculation is done in our clinic for some patients. Sometimes patients ask for it. This is not a very reliable indicator of anything, but still some people are very kind of worried about their body fat percentage, and we do it. So any woman with a body fat percentage more than 32% and men more than 25% would be considered in obese category. However, we have very kind of cheat sheets where we look at, and this does go by age. So younger you are, more strict the guidelines are, and the older you are, you do get some slack. This is not a very good indicator of anything. If somebody is really trying to lose weight and they feel good knowing that they are actually decreasing their total fat percentage, then we do that. But it really is not a very valid indicator of anything, and it's not considered a part of your normal physicals. Some people, as I said, do ask for it, and we do it. Next slide, please. So waist circumference, this is a very valid and reliable indicator. For a man, the healthy waist circumference should be less than 40 inches. And for non-pregnant women, a healthy waist circumference is less than 35 inches. Remember, this difference is because women have more curvy bodies. So 35 inches or below is considered healthy. Now, other thing is, if you have excessive abdominal fat, you are at a greater risk of type 2 diabetes, high triglycerides, high total blood cholesterol, high blood pressure, and eventually leading to coronary artery disease. This waist circumference really has been used in a lot of studies to look at how much of fat around the abdomen is an important factor in a future risk of heart disease. And a lot of studies have indicated that people with apple-shaped bodies, like more fat around their waist area, are more at risk of future heart disease or coronary artery disease compared to people with pear-shaped bodies, meaning more fat around the buttock area. And so I think this is kind of true for a lot of women, because women with the curvy bodies but having more fat around their buttock are not considered as much at risk of heart disease compared to somebody who has more abdominal girth or more fat around the waist. I cannot explain why is this so, because when you look at weight, you're looking at total body weight, but abdominal fat by itself is an independent risk factor for increased risk of heart disease in future. Next slide, please. So what are the health risks of obesity or being, having a body mass index more than 30 for your height? So as I said, when your body mass index is more than 40, that means somebody is morbidly obese by itself. It becomes a disease in itself. But if you are between body mass index of more than 30 and less than 40, you are still at high risk of high blood pressure, coronary artery disease or heart disease, diabetes, sleep apnea, osteoarthritis, stroke, and cancer. So this is kind of interesting. We all know that being overweight leads to increased risk of high blood pressure, diabetes, and heart disease, and you've probably heard it so many times, but it has been really proven in the studies that overweight people or obese people, if they can lose weight, they do decrease their risk of breast cancer and colon cancer. And also, people who are obese for their height tend to have more tendency to have breast and colon cancer. So I think in my mind, when I talk to people, I tell them that, I'm not telling you that lean people do not get a disease and they do not get cancer, but your weight does increase your risk of getting these cancers. So it's very important for you to do your part and try to lose this weight. Next slide, please. So leading factors of disease, we are going to talk about now. Next slide, please. So cholesterol, we all talk about cholesterol. What is its importance? What is cholesterol? So cholesterol, look at the picture on your right-hand side. It's a waxy fat-like substance in the cell membranes. It is a building block for bile, vitamin D, testosterone, estrogen, and other hormones. So we do need some cholesterol in the body because it also gives the sheen to our skin. The sheen that you have on the skin and you glow on the skin is to some extent cholesterol. So we do need some cholesterol. But if you have too much of it, and that is the problem with our culture now, that we have too much of cholesterol in the body, and this can create the artery clogging particles, which can lead to the plaque buildup and eventually lead to heart attacks. So this shows that this is kind of a cross section of this is like a little cartoon is showing you a cross section of a big artery. When you start having the more of the cholesterol, it attracts more of these cells that you're seeing, more red cells, more platelets, and a lot of other inflammatory markers there. So this becomes a huge plaque, and when this plaque ruptures, it releases small clots, which can go up to the smaller arteries in the heart and cause blockage, and this is eventually what leads to your heart attack. Next slide, please. So it is very easy to check your cholesterol. It is considered a very important test, but a very simple test. It's basically a blood test and has to be done fasting. Lab calls it a lipid profile. That means the whole cholesterol panel is checked. And recommendations say that you should start testing people between ages 18 and 20 first time, but younger kids are now being tested if they are obese or overweight, and if they have any family history of heart disease or high cholesterol, then younger kids are also checked. So when you look at the results are going to show you HDL. H, remember in your mind, H is healthy cholesterol. It's high density lipoprotein. So H should be high. And L is low density lipoprotein or bad cholesterol, we call it. it should be low. L should be low, H should be high, because H is healthy, and just to remember, L is lousy. And then there is another kind of a bad cholesterol, which is VLDL, very low density lipoprotein. It has not shown to have much significance in causing the heart disease in future. So even though the lab does report VLDL, we do not pay much attention to this. It's only more for kind of studies and stat purposes. And we do not target this with medications. And then triglycerides is a kind of bad fat also, and it is carried by blood and stored in fat cells. So usually you see that we have gone back and forth on the importance of triglycerides. We know that this is a kind of a bad fat, but whether it increases the future risk of heart disease, that's where there's a lot of kind of controversy. But we also know that people who have pre-diabetes or diabetes tend to have more triglycerides or elevations, and anything that is both fatty and sugary, for example, cakes, pastries, ice creams, tend to increase your triglycerides. So we tell patients to stop all of those things if your triglycerides are high. In fact, if triglycerides are very, very high, they do increase the risk of having pancreatitis, which is the inflammation of pancreatic gland. And these people can really end up in hospital because pain is intense. So triglycerides do have some kind of significance when it comes to future risk of heart disease, but they can cause other issues like pancreatitis. So we have to be careful. And it has a very strong genetic predisposition. You know, if other members in the family have high triglycerides, you tend to run triglycerides on the higher side. But the good news is your LDL, your triglycerides really do come down nicely with very strict low fat, and to some extent for triglycerides, low carb diets. So we also report your total cholesterol, which is calculated by taking into account your good cholesterol, your bad cholesterol, HDL, LDL, and VLDL. Then cholesterol ratio is basically calculated by your total cholesterol divided by your good cholesterol, and it gives you a number. So it's important for everybody to get this test at least once a year if you are an adult, because it does carry a lot of importance when it comes to calculating your future risk of heart disease. And nowadays, treatment for high cholesterol has changed, and I'll go into a little bit of more discussion later on. Next slide, please. We're going to talk more about blood pressure. So when your heart beats, it creates a pressure in your arteries, which is called blood pressure, right? So blood pressure is always referred as two numbers, the top number and the bottom number. The top number is called systolic blood pressure, and the bottom number is called diastolic blood pressure. Next slide, please. So systolic, or the top number, is the pressure in the arteries when your heart beats. You know, when your heart contracts or beats, this is the pressure generated in the arteries, and this is called your systolic, or the top number. Diastolic blood pressure is the pressure that is generated in the arteries in between the beats. So the bottom number, and usually the top number is always higher than the bottom number. Next slide, please. So high blood pressure or hypertension is basically a disease. High blood pressure could be due to other factors. It's basically caused by several factors, including little or no exercise, poor diet, being overweight or obese, age, and the strongest really risk factor for high blood pressure is your genes or heredity. So when we talk to people, we always tell them, you can blame anything on your genes and you can really feel good about it. But the reality is, regardless of whatever is causing you to have high blood pressure, your body is getting a hit, and we have to do something about it. So we cannot change certain things in life, like we cannot change your genetic predisposition, and you cannot stop your age, but you have to focus more on the things that you have control over, which includes your diet, your exercise, and of course, making sure that you are consistent with your diet and exercise. So hypertension is usually diagnosed when your top reading is more than 140 and bottom reading is more than 90. So I will also tell you that this is kind of an old recommendation. Nowadays, we have become very strict with these numbers, because if you wait for blood pressure to stay over 140 and 90, then sometimes the damage is already done. So nowadays, the new number, we look at numbers in younger people, younger means less than 65, as 130 on the top and 80 on the bottom, and your blood pressure ideally should be less than that. Next slide, please. So this is, kind of a new guidelines. You see that 140/90 that I told you earlier was a previous guideline, because nowadays it's considered pretty much stage 2 hypertension. So this is the latest guideline, right? Most people should ideally be less than 120/80, but up to 130 on the top is okay. You can say it pre-hypertension, but when you come to us, we really think that it's fine. If you are staying in 120s on the top and staying in 70s at the bottom, that is great. You are considered to have normal blood pressure. If you're consistently staying in 130s on the top and 80s on the bottom, then we are little concerned about you. This is the group where we are going to focus more on diet and exercise. And if you're consistently staying more than 140 on the top and more than 90 at the bottom, this is the stage, or this is the number where we will recommend medications in addition to strict low salt diet and exercise. Next slide, please. So, this is kind of an interesting thing about salt. We know that salt is not good for body. Certain ethnicities like African American people are more salt sensitive. Once you develop high blood pressure, something happens in the body that your salt sensitivity increases. Now, even if a little bit of salt can really cause high elevations in blood pressure. So it is important, if you've been diagnosed with high blood pressure or hypertension, you need to limit your salt intake. The good thing is that we do not cook with a lot of salt. I mean, if you look at American households that are cooking at home, I don't think we have that much heart to put a lot of salt in our food. Most salt that we consume comes from processed foods, prepackaged foods, or restaurant meals, because salt increases the palatability of your food. It makes your food taste better. It also increases the shelf life of the foods. So, restaurants are not going to compromise on the taste, and they are really, food industry really wants their whatever box foods are to stay longer on the shelf. So they do put a lot of salt. It does make your food or meals taste better, but then, you are compromising your health. So you have to kind of understand that. American Heart Association recommends more than 2,300 milligrams of salt each day, which comes out to be like one full teaspoon of salt a day. If you eat out a lot, or if you buy a lot of stuff from like boxed foods, try to check their nutritional labels and try to look for the sodium content to manage your intake. A lot of times you can't calculate every milligram of salt that's going inside the body, but try to avoid, things which contain a lot of salt, or try to calculate, look at the labels. Or the best thing is try to limit the intake of anything that comes in a packet or in a box. So, because those are the things that are considered processed and have pretty much a lot of salt. Any frozen entrees, most of the frozen entrees of meals really are filled with sodium. And if you are cooking same thing at home, you will never end up putting that much salt in your food. Next slide, please. So who should really be careful with their salt intake? Anybody 51 and above, because remember I told you age becomes a risk factor for heart disease and high blood pressure also. So if you are at a certain age, you should try to watch out for your salt intake. If you have high blood pressure, now you are more salt sensitive, so you have to be very careful with the amount of salt you put inside your body. If you're a diabetic, most of these diabetic people do have tendency to develop high blood pressure or have chronic kidney disease. So that becomes very, very important that you watch out for your salt intake. And as I told you, African American ethnicities, for some reason, this ethnicity, the whole group is considered more salt sensitive compared to some other ethnicities. So you have to be a little bit more careful. Next slide, please. And the most important thing is get your regular checkups. Don't miss out on your regular screenings and immunizations. So right now, I would highly recommend flu shots. The flu season is here. And of course, if you are sitting on the fence regarding COVID vaccine, please get your vaccine. It is safe, it is easily available, and it's free to you. And it does protect you from a disease which could prove to be fatal for a lot of people. So, just remember that, go to your doctors, do your regular checkups, do your screenings, and ask for immunizations, which are, some of these are seasonal, like, flu, and some of these are based off on your age and risk factors like shingles vaccine and pneumonia vaccine. So try to get all your shots. We have a long history. We've done a lot of studies. Vaccines are safe. Please try to get all the recommended vaccines. Next slide, please. So what we eat or what we put inside the body actually has a lot of, a say so in what our future is going to be like. So whenever you're eating, look at your plate. The more colors your plate has, it indicates that you're really eating healthy. So if you're eating more white stuff, that's probably not good. Any color in the plate really indicates that these are all foods which are filled with a lot of vitamins and antioxidants. So fill half of your plate with fruits and veggies whenever you're eating, or at least try to do that. Choose foods that are lower in sodium and sugar. Focus more on lean proteins and whole grain carbs. So it's okay to eat carbs, but try to eat more whole grains. So remember, whenever you're choosing your foods, darker color is better than the lighter color. Example would be whole grain breads, which are darker in color, are much better than your white breads, which have been stripped of a lot of nutrition and fiber. Choose water over alcohol or sugary drinks most of the time. Occasional drinking of alcohol and all the other things that you enjoy is okay, but most every day you should not be opening a can of Coke with your every meal. That's what you do not want. Eat only when you're hungry and stop when you're full. Sometimes we really are doing mindless eating, and I know that I've done it myself, because we are so busy working during our lunch hour on our laptop or our desktops, and we are eating and we're not thinking about it. That is the wrong way of doing things, because think of your meal time as a time that you are connecting with your food. Like when you're praying, right? You're connecting with God. So when you're eating, you should connect with your food and try to enjoy your food, because that is the most important thing. What you're putting in your body at what speed and when you stop would probably help you not getting sick in future and avoiding all the things that we have been talking about in this, your lunch discussion. So be aware of your portion sizes. You can always eat more later, but trust me, if you have overeaten already, you cannot go back in time and eat less. And a lot of times we all have done it to ourselves. We eat so much and then we tell ourselves, oh my God, I shouldn't have done that. I mean, this is not right. But we keep on doing this over and over again. So try to get out of that habit, and the only easy way to do it is connect with your food. Sit down, look at your plate, enjoy the flavors, enjoy what you're going to eat, and relish every bite. And if you eat slowly and chew slowly and enjoy your meal, you're not going to overeat most of the times. It's only when you are eating in a rush, when you are not paying attention to what you're eating, when you're eating while looking at your desktop screen, or when you are watching TV, that's the time when you don't even know what you're eating and you don't even know whether you're full or not. Next slide, please. Exercise is beneficial. We all know that. But what are the most important benefits of exercise? First is weight management. Exercise does not necessarily let you lose weight. That comes mostly from eating right. But if you lose weight and you want to maintain that loss, that comes from exercise. You can't do one over another. You have to go on a healthier diet or low calorie diet and do exercise, so that the weight that you lose, you are able to maintain that loss. And also exercise improves your cardiorespiratory fitness and muscular strength. Your heart and lungs function better if you do what is called aerobic exercise. For example, running, jogging, anything that makes you feel like you are tired at the end of the activity is mostly your cardiorespiratory exercise. And it does improve your muscle strength. For example, it improves strength in the legs if you're running, and if you are doing like elliptical, it does improve the strength of your upper and lower limbs. And people who exercise, and this is a very important point, they actually improve their balance, so much so that they prevent falls. And there have been good, robust studies done in elderly patients and nursing home residents where it shows that regular exercise in this age group, or like older people or elderly people more than 65, it does improve their sense of proprioception, or balance. And these people actually are less likely to fall and break their bones if they do regular exercise or whatever exercise they can do. And people who are depressed, this is exercise is kind of cathartic. So it does decrease your symptoms of depression. In fact, when people have mild depression, we tell them before putting them on medicines to go exercise or run, and it does help with their symptoms a lot. Next slide, please. So also, when you look at what other benefits the exercise have, it does decrease your risk of early death due to any cause. It does decrease your risk of coronary artery disease or heart disease, stroke, high blood pressure, high cholesterol, type 2 diabetes, colon and breast cancer. So remember, all the things which can be increased due to being overweight or obese, the risk can be decreased by doing regular exercise. Next slide, please. So when do you know you're doing enough exercise, right? I mean, a lot of patients ask us, when would I know, or what should I do? So as a general guideline, 30 minutes of exercise, moderate exercise, most days in a week is a recommendation. This recommendation doesn't mean that you're going to lose weight. It means that you'll stay healthier if you do that. So if you can do 150 minutes each week of moderate intensity aerobics or vigorous or high intensity aerobics, that would be half of the time, like 75 minutes. That would be really considered ideal. You have to start somewhere. If you can do this much, start somewhere, whatever you want to do. And how do you know whether it's moderate activity or intense activity? So if you're breathing hard enough that you can still talk, but you cannot sing when you're exercising, this means moderate exercise or moderate intensity exercise. But if you're breathing hard enough that you can neither talk nor sing, then you are exercising at a vigorous level or high intensity exercise. Of course, this is for people like you and me who are really not considered professional athletes. Their fitness level is very different. They can still be doing a high intensity exercise because of their training and not, have all the, symptoms that I'm telling you, like breathing hard, because these people, because of their training, they really can do a high intensity exercise and not feel like they are panting or they are really, needing to breathe deeply. But for us, most of us, this is how we know. And strength training is also important in addition to your aerobic exercise. So strength training basically is toning up your muscles more and improving your basically the look of the body, and how if you've lost a lot of weight and now you want to tone up your muscles, that's where strength training comes to play. And also strength training is important because it overall decreases your risk of falls, and it also improves your stamina. So work out each major muscle group 2 times a week. If you're a sedentary person, otherwise you really don't need to be lifting weights or something every day. So 2 times a week, or between 2 sessions, you should give at least 48 hours. So, right, you have to skip a day to do this kind of exercise. And again, I'm telling you that this is for normal, regular people. This is by no means, any kind of a guidance for somebody who's a professional athlete or is training for some kind of a professional event. So try to work your legs and hips, your back and abdomen, chest, shoulders, and arms. So you can, do these exercises in different parts of body every session, or you can do all the whole body in one session and then give yourself a break and then do it any way you want to do it. So at the end of the session, your muscles should feel tired, but you should not have pain. So if you are doing weight training, increase your weight or resistance only if your muscles are not hurting and they are not feeling very tired. So you have to start low and go up slow. Remember, if you've never done any weightlifting, do not start up with 20-pound dumbbells. You have to go slow, very, very slow. And everybody's different. I mean, I tell women, most women ask me, where should I start? I've never lifted weights. I tell them, start up with 6 to 8 pounds and gradually increase the amount of weight you want to lift. And if you're much older, I just tell them to walk with weights, or when they're sitting, put some ankle weights. Sitting on a couch and watching TV, these elderly women should put some ankle weights and try to raise your leg with the ankle weight. So that gives them some strength to their lower body muscles so that they do not fall easily. Next slide, please. All right, so the only thing I want to tell you if you're a smoker is to quit smoking. Smoking does not have any health benefit. Smoking causes direct damage to your blood vessels and it blocks critical arteries near the heart. If you're a smoker, the only thing you need to understand is you have to quit smoking. Next slide, please. Exposure to secondhand smoke also can cause heart disease and lung cancer in non-smoking adults. And this is very important if you are a parent and living with young kids. You really should not ever be exposing kids to, any secondhand smoke. Non-smokers exposed to secondhand smoke at work or home can also have their heart risk increased by 25 to 30%, and lung cancer risk also increases by 20 to 30%. Breathing secondhand smoke has an immediate harmful effect on your cardiovascular or heart system, and it does increase the risk of heart attack. So if you already live with somebody who has a history of heart disease, and if you're smoking around them, even though those people are not smoking, you are actually increasing their future risk. So be careful. Do not smoke. Do not smoke around elderly people. Do not smoke around young kids, because for one, you should not be smoking, but if you have to smoke, you go out and smoke when people are not around you. Next slide, please. And sleep is another thing that I will touch briefly on. Sleep is essential for your good health, your mental and emotional well-being and safety. Average adults need like 8 hours. I would just pick up a number. Most of us should have at least 8 hours of restful sleep. Kids do need more, and elderly people, really their sleep pattern is disturbed and they don't sleep as much. But amount of sleep you really need is basically dependent on a lot of other factors and how you feel, but you have to feel rested in the morning. There are people who could get 7 hours of good restful sleep and feel very, very functional, compared to somebody who's tossing and turning in the bed for 10 hours and still feels kind of not rested. Sleep requirements vary and they are really not set in stone. Next slide, please. So that pretty much is kind of what I had to talk about your prevention and things that are important. This is on your slide. It's a kelseysiebel.com is our website. You can find a lot of helpful health tips and information. And then is our main line. Now, at this time, I know we are pretty much at the end of the hour, but I am open to any questions that you may have. You can type them in the chat, or you can just, if you have anything that you want to speak out loud, that should be fine with me.
Okay, thank you, Dr. Sehgal. That was a wonderful presentation. It was very helpful. Okay, so checking the chat here. If you have questions at all, you can go ahead and place them in the chat. You can unmute yourself to ask your question if you're more comfortable doing that. I will go ahead and get us started with the first question. So question number one, or the first question that I have for you, you mentioned the importance of going in for annual exams. Can you just kind of walk through what should be done during that visit?
Okay, so this is a kind of a very open-ended, wide question. So when we tell, there are so many people that come to us only once a year because they think that once they've seen the doctor, everything has been done. So when you go see your doctor, your physical exam is important, and different things are done for different ages because this is sometimes gender and age specific. So I'll talk more about adults. Let's say anybody who's 21 and above, a man or woman, they should get their blood pressure checked. They will have their weight, they'll have their height, they'll have your body mass index checked. And then, of course, their heart rate and respiration and temperature is checked at every visit. This is a set of vital signs that you are going to have. After that, the doctor will talk to you about your past medical history, past surgical history, past any history in the family of any disease. And that would kind of guide us to what you need, because certain things are only done if you have more risk of that condition in your family. But pretty much everybody will have their cholesterol checked, their blood sugar checked. Sometimes we'll check your kidney function. If you are a woman over 21, we will offer you a pap smear, for cervical cancer screening. STD screening is done in women and men less than 25 years of age, or if we feel like somebody has more risk of disease. Now, if you've never been sexually active, then you do not need STD screening, but somebody who has been sexually active, then HIV should be checked. Gonorrhea, chlamydia should be checked in women, and these are United States Preventative Service Task Force guidelines. If you are a smoker, of course, you're going to get counseling from your doctor regarding trying to stop smoking. If you have any other symptoms that physical, like depression or anxiety, or you're worried about certain things, then those things would be talked about in that visit. And then also, you will be given any vaccines that are age appropriate at that time. So at 21, let's say in flu season, you'll be offered a flu shot. If you've not done your tetanus booster at age 18, you will be offered a tetanus shot. And nowadays we are paying attention to COVID vaccines. If you've never been vaccinated, we want to address that vaccine hesitancy with our patients. We want to know, why have you not been vaccinated? Do you have any questions? Do you want to know more about that? So we'll talk about that. And also, if you're a diabetic, let's say, then you'll have a little bit more labs done to look at your diabetes. And then diabetics also need additional shots like pneumonia shots and hepatitis shots. So those diabetics, even though they come for their preventative screening, will have more vaccines compared to somebody who's not a diabetic. Same thing with anybody who's a smoker, somebody who's an asthmatic, somebody who has certain other lung diseases. So they do require pneumonia shots. So there are certain guidelines for certain shots, which are not for everyone, but pretty much most everybody should get their age appropriate vaccines also. So this is kind of a comprehensive, exam. And if you are otherwise young and healthy and have no disease and not any kind of a very worrisome family history, you should at least get your vaccines up to date. You should know your numbers about your blood pressure, your cholesterol, your sugars, and you should know your BMI. I think that's probably, to sum it up, that's what you'll have in your preventative exam or annual physical.
Okay, thank you so much. The next question that I have for you comes from the chat. Could you reiterate on how to maintain body composition after someone has lost weight?
So I'm trying to understand it. I think this person wants to ask me, how do I maintain my loss after I have lost weight, right? So the most important thing, once you have lost the body weight that you wanted to lose, is maintaining that. And that is probably the hardest part. So for that, your diet becomes very, very important. Of course, I told you the importance of exercise. You'll have to do regular exercise, but diet becomes very important. So a lot of people, when they go on certain diets and they try to lose this weight, they do not do what is called a sustainable diet, right? You can't starve yourself for very long if you really cut down your calories to 500 and lost all this weight. So talk to a dietitian, sit down with a professional and try to understand, because once you have decided to lose weight and have actually lost some weight, then this diet should be your lifestyle. You cannot go back and forth between losing weight with certain diet, and then when you stop the diet, all the weight comes back on. So diet is pretty much the most important thing when it comes to losing weight, and exercise in addition helps you sustain that loss or maintain that loss. So both exercise and diet, but I tell all the patients all the time, you have to understand, this is not a short-term goal. This is a long-term goal. You have to make sure that you continue doing these things. So this should be a part of your lifestyle now, so that you do not gain that weight back. And everybody would gain some weight back, because if you went on a very restrictive diet and now you are getting to more normal diet, you will gain some weight, but that's okay. You should not go back to your weight that you started at.
Okay, thank you. Thank you for asking that question in the chat. Speaking of diet, you did mention the Mediterranean diet. Can you explain a little bit more what that diet looks like?
So Mediterranean diet has been shown to be the healthiest diet, right? And it's not necessarily a weight loss diet, but it is a very healthy diet. So if you guys want to know more information, look at DASH diet, DASH. DASH stands for Dietary Approaches to Stop Hypertension. DASH diet is very close to Mediterranean diet. So what these diets focus on, these diets usually include more fresh fruits, fresh vegetables, a lot of nuts, and then for the fats, they use more good fats like avocados and olive oil. And, of course, Mediterranean diet uses a lot of olives also. And then they also do some lean meats, like lean protein, like whatever the lean cuts of your any kind of meat. They focus more on fish and chicken. And then, of course, low fat dairy. So this is by no means a weight loss diet. If you're really trying to lose weight, this is not a perfect diet, because it does have fats in it, and but it is essentially, if you look at it, mostly like a low carb diet. But if you are trying to lose a few pounds, but you want to feel overall good and healthy, and you really want to maintain your stamina and feel good about yourself, I would recommend this diet. And yes, a lot of people do lose weight on this diet because it's not putting a lot of emphasis on carbs. So it does have some carbs. It does talk about whole grains, and their diet is very colorful. So go on a website, look at DASH diet. It will tell you more focus on foods that do not come from packages. So it's Mediterranean diet and DASH diet are teaching you principles of eating good. And these are not diets that you can get in a package, like, there are Nutrisystems and Jenny Craig's, and they give you prepackaged meals, right? But this diet, you have to understand the principles of eating right, and then you make your own diet. You always focus on what is good from bad. And I think it's important to understand this, because then once you are changing your lifestyle, it becomes easy, because you can't be on Nutrisystem or Jenny Craig or any other kind of diet for your life, because these are expensive. Whereas Mediterranean diet, go on Google, look at Mediterranean diet, look at DASH diet, and print those papers. And the next time you're doing grocery shopping, try to do more of those foods.
Thank you so much. So the last question that we have comes from the chat, and it says, can you talk a bit about thyroid health?
Okay, that's very important and interesting to me. So, thyroid gland is a gland at the lower part of neck, and this is a very important gland because it releases thyroid hormone, which is a metabolic hormone. So thyroid hormone does control your metabolism. If your numbers are below a certain level, like less than 0.4, so the normal range is 0.4 to 4. If your numbers are less than 0.4, you tend to be considered hypothyroid. That means your gland is not releasing as much hormone in the body, and you have a hypofunctioning gland. So what you have is called hypothyroidism. So all your metabolic processes are slowed down. People with low thyroid hormone tend to feel more tired. They have low energy. If women have hypothyroidism, it can affect their menses. And so think of it, everything is kind of little slowed down. People with low thyroid tend to have more depression, and these people can have high bad cholesterol. So if we see somebody who has low thyroid and high bad cholesterol, we try to treat their thyroid first before jumping onto their bad cholesterol. And those could be two different things also, but usually if the bad cholesterol is a little bit high and thyroid is abnormal, we should treat thyroid first. On the other hand, if your thyroid gland is releasing too much hormone, that means the gland is hyperfunctioning due to any reason. It could be a tumor in the gland, or it could be a nodule in the gland which is hyperfunctioning. You now all of a sudden have this too much thyroid. Then too much thyroid it's a metabolic hormone. So all the systems in the body or metabolic processes in the body are revved up. These people tend to feel spent and tired all the time because everything in the body is at a higher speed. They are in a hyper-functioning state. These people have anxiety. Their heart can go in different rhythms because heart beats very fast, and a lot of times it can go in irregular rhythm. And atrial fibrillation can happen in people who have hyperthyroid. And these people always feel anxious and tired, and they do not feel well. People with hypothyroidism sometimes do not know because their metabolism is gradually goes down. But if you have a hyper-functioning thyroid, these people usually would know because they feel anxious, antsy all the time, like something is not right. They cannot sit still. They have diarrhea. Anything they eat that comes right through. They do not gain weight. But it's not a good thing that they do not gain weight. They actually feel sick. So both hypo and hyper are not considered good.
Thank you so much for answering that and for that question in the chat. We really appreciate that. So I'm going to go ahead and wrap things up. Thank you so much, Dr. Segal, for taking time out of your day. We really appreciate it. This was a wonderful presentation. We did record the presentation today, so if you want to go back and watch it again, it will be posted on our YouTube channel. I encourage you to share the presentation with others in your life who maybe weren't able to join the live session today. If you have any questions or comments after this presentation, you can always email us at healtheducator@thewomensfund.org. And then we also have a survey. We would really appreciate if you would take a moment to complete this survey. Let us know how we did. Hopefully we'll be able to get the survey link sent out to you through email. But we would love to hear back from you what you liked, what we can improve on, and additional topics that you're interested in hearing. Finally, on the left-hand side of the screen, we have our website and our social media handles. Feel free to follow us on our social media sites, see what we have coming up. We post a lot of fun things there too as well. And then as far as upcoming events with UHD, for October, we will have a presentation over breast cancer. And then in November, right before the holidays, we have a presentation over self-care. So if you haven't registered for those yet, they are up on our website. Go ahead and register if you're interested. But I thank you so much for taking time out of your afternoon to be here today. We really appreciate it. And I hope you all have a great rest of your week.
Thank you. Bye.
Thank you.
Bye, thanks.